Skull base is divided into anterior cranial fossa, middle cranial fossa. And for the boundaries, you're just playing really. You're not saying anything. You're just playing with the names. And the floor is represent the roof of the eyes on both sides and the cribriform plate in the middle. Middle cranial fossa, what are the boundaries? Anterolateral, lesser wing of the sphenoid. Number 32, anteromedial, anterior clinoid. Number 1, posterolateral, the superior part of petrous part of temporal bone. This is your temporal bone. There is a video on YouTube that I made that solely explains the temporal bone. Just watch it. So, right? So this is the temporal bone. It has squamous part and petrous part. This is the superior part of the petrous part of the temporal bone. 21. And that represents the posterolateral boundary of the middle cranial fossa. Posteromedial is your posterior clinoid process and your dorsum sella. All right? The floor is formed by the squamous part and the petrous part of the temporal bone and also the greater wing of the sphenoid. So these are the boundaries of the middle cranial fossa. Posterior cranial fossa, you're just playing again. All right? So anterolateral is the petrous, the superior part of the petrous part of the temporal bone. Posterolateral, you have all the parts of the occipital bone. All right? So we're literally just playing and all the cranial fossa done very quickly. Boundaries of anterior cranial fossa, frontal bone, lesser wing of the sphenoid, anterior clinoid, frontal bone of the floor with the ethmoid bone, cribriform plate, middle cranial fossa. You have anterolateral, and posteromedial, and the floor. Anterolateral, lesser wing of the sphenoid. Anteromedial, anterior clinoid and limbus. Posterolateral, petrous part of temporal bone. Posteromedial, your dorsum sella. The floor is squamous and petrous part of temporal bone and the greater wing of the sphenoid. As simple as this. All right? What are the contents of middle cranial fossa? It has your temporal bone, your temporal lobe, and the temporal lobe and the cavernous sinus.